Let's talk about traditional Medicare here for a moment. Okay, so if you have your Medicare ID card and your Medicare Supplement card and you go to your doctor, hospital, service provider for something that is medically necessary, rehabilitative in nature, and they see continued improvement, those are just 3 terms for medical billing, then Medicare is going to pick up 80% of your care. Now let's talk about this for a second. 80% of every senior in the United States care. That's what Uncle Sam's on the hook for right now. That's a big number. Healthcare is expensive. 80% is what's going to happen. And by the way, we're living very long. And so this is a part of the reason why there are alternatives. But here's the deal that we've got. They're picking up 80, and we're on the hook for the 20% plus deductibles. Now, the portion that you end up ultimately paying at the end of the day will be determined based upon which Medicare supplement program that you go with, plans A through N, and I'll just discuss them in a moment. But these Medicare supplements or Medigap policies, they're health insurance sold by private companies to fill the gaps of original Medicare. You got to have A and B, continue to pay your Part B premium. But here's the aha moment. All Medigap plans are standardized with plans A through N. Means that they're the same. They're identical. There's no difference in network. There's no difference in doctors. There's no difference in the benefits in them. That's all federal. And so let me show you something. We've got plans A through N noted here. And you'll note we didn't just try to pull C and F off to the right and be out of alphabetical order. It's just how it works out here. You guys know how 2020 was kind of a weird year for a number of things? Okay, I'm going to share one other component. In 2020, there were 2 different groups of people defined by Medicare. Those who are special were born in 1954 and earlier, you're special. 1955 and later, you are young. No one's wrong. Special or young, okay? So I didn't label anything bad. But those who are special have an opportunity to continue to enroll in plans C and F. And those who are young do not have that same opportunity because these benefits were considered to be excessive, and they wanted you to feel a little bit of pain when you were first making your payments out of pocket. Why? Because under Plan F up here, you can see that there's a check mark in every one of these boxes. Ultimately, if you got a Plan F, and let's just say that you had cancer, you could just go in and get your care, and that's it. You're covered. Okay, as long as your doctors are billing Medicare and you're receiving medically necessary treatments, you're good to go. So what they've done now is they've said, hey, Medicare Part B, that deductible, that $257, we want you to pay the first $257 when you see your doctor. Kind of like a copay, but it's more of a deductible, right? And it kind of stings a little bit. $200, gee, that's a lot. I'll note this for you. Plan G today is the one that has the most check boxes in it, and it's the one that I would say is the most comprehensive right now. I wouldn't feel too bad about not being able to get into a C or an F, and here's why. We need to understand how medical insurance works. How medical insurance works is this. The healthy people are paying premiums while sicker people are using those premiums to receive care. And what happens when you stop all the young and healthy people from getting into the system? The price goes up. The C and the F are unsustainable long term. They're going to go out of control. People that want to stay in them will stay in them. It's just going to become extremely expensive. There's so many examples of this and inside of healthcare. But the Plan G, if you look at it and identify what your options are, we think that you can find comparable and ideas, and you can probably even find some savings in looking at Plan G, including if you are special and have the ability to do a Plan F. Okay? So this is a Medicare Supplement Program, Medigap plan, and that's an important consideration. Okay. Medicare Advantage. You must have Part A and B and continue to pay the Part B premium. Okay? You also must live in the service area of the plan that you select. Remember, it's a county-by-county basis. And so if you move from one county to the next, they don't necessarily, send you a letter and says, hey, you just moved counties. They should, but they don't necessarily. I'm just going to share with you, it is based on that county that you're going to be able to get that plan.